Morning, Bones.
Morning, Padre. What's happening?
Well, I thought with all going on and all the conflict about medical care right now, maybe it would be a good time for us to jump into our thoughts on what's going on with it, where it's come from, and some of the things being proposed. Uh,
Yeah, that's been an everyday thing in the news, local and national, since they reopened the government.
well, and it was in the news. That was the reason that they closed down the government was the inability to agree on Affordable Health Care Act. Uh, I kind of wanted to delve back into the question of why and when did the government become involved in public health care?
Okay. All I can do, I mean, I don't have exact dates, but all I can do is reflect on my personal experience with healthcare uh,
Mm-hmm.
from my from my time of becoming employed and making a paycheck
Right.
from a substantial company. So this is in the 70s, about 74. But I got a job, and they handed me an insurance card. And in Utah at the time, it was Blue Cross Blue Shield,
Mm-hmm.
major insurance. So I would go to the doctor, take my wife to the doctor, my child to the doctor, hand them the card. Insurance covered everything, no copay whatsoever.
Okay.
And government got involved, started mandating things to the doctors, such as uh, the amount of malpractice insurance that they had to carry, all this stuff. So their costs are going up. So then the copay came into play. They had to
Okay.
pay a copay,
Right. To
you know.
help cover some of the costs that are now being forced upon them.
Right. And then the government's fingers got further in there, so they mandated high-priced insurance for the medical facilities, the people that provide the space for the medical facilities, the pharmaceuticals, but
Mm-hmm.
anybody that practiced medicine, so they escalated that. So what happens is our premiums go up because they got to cover costs, and also, the copay keeps rising and rising and rising.
Yeah, and I guess that makes sense on how it happened because, like you, I recall, my first employments when I got out of the service. Uh, like you said, you get hired on, you fill out your insurance paperwork, individual or family. Your employer paid, well, at that time, my employer paid 100%. I didn't have a copay. And a few years later, okay, you need to pay $9 a month for individual, $18 a month for family, which, ain't no big deal there. And then it came, you can choose different plans. You can choose this plan that has no copay. You can choose this plan that has a copay and pays for so much of this, so much of that. Pays 80% of hospital stays, or however they broke it
Right.
down.
And then they separated eye care and dental,
Right, right.
you know.
Then vision and dental became separate entities, uh, and and the cost started going up. So when this started occurring and the costs started becoming high, I was working for the state at the time, well, the city government, but basically the state of Utah, under the umbrella of state of Utah. And they broke off and created their own, they became self-insured under what they
Yeah, I
call
think that
public employees health plan.
right. There was a few professions that did that. The education
Mm-hmm.
did the same thing. So yeah, yeah.
Yeah, anything under the state government, education, law enforcement, firefighters, public works, they all started paying into the public employees health plan, and the company was self-insured, and that was in an attempt to lower the costs that were being implemented, as you said, through the medical providers and their associates. Uh,
Yeah, and that's because of the government mandates that
right,
were put on them, you know?
right. And then all the regulations, even through the private insurances, started going up. Your co-pays, out of your paycheck went up. Your co-pay at the doctor's office went up. Your plan started being watered down to get any kind of premium insurance. Now you're going to pay $300 a month for a family so that you don't have to pay all these horrendous co-pays and prescriptions.
It's substantially more than that, and it also is age based. Um, so I was paying near 600 a month
Mm-hmm.
towards my towards the end of my employment,
So,
plus the copay.
right. And so the government control and mandates through licensing of these doctors. In order to have a license to practice, you've got to have malpractice insurance. You've got to have, all these other things in place as a doctor to have a license, as a facility to be licensed. The government control. But then we start looking at what occurs in the Obamacare era. Mandated insurance, supposed to bring the
Every
cost
yeah,
down.
yeah, everybody will have insurance one way or the other, but we'll also give it to the illegal aliens. They won't have to pay.
Right. So anybody working, it's mandatory that you have insurance. And if you don't have insurance, when you file your taxes, you're going to be fined substantially, more so than if you would have paid for the insurance. And yet, as you stated, illegal immigrants and lower income families were getting everything for free, subsidized by the high price being paid by those that worked. And the cost didn't go down, by the way, people. The cost did
Oh,
not go down. The program obviously failed, which is where we're sitting at today.
yeah, it continually rose, and it rose in cost worse than it did before the Obamacare.
Right.
You know,
Because now it's under
every year.
now it was under total government control. They controlled all the health insurance and mandated who was going to pay what, handed it out for free like candy to the people they wanted to give it to. And yet, at the same time, the politicians had their own plans separate from what the public was being allowed to choose from. They had their own plans and their own costs that they voted in. These rising costs are the center of the big political argument today, with the Democrats pushing for Obamacare, which is Obamacare. That's what it is, but it's called the Affordable Care Act or Health Care Act, and
And
they're
it's trillions of dollars in debt right now. The
right.
Affordable Care Act.
They're asking for trillions of dollars into the budget to help subsidize this program for the next few years. And the costs are just going to go up. Now, they're threatening that if Obamacare or Affordable Health Care Act isn't subsidized, that the costs are going to go up astronomically for the American citizen. So Bones was talking about four 4 points of contention or concern that the people have with what's going on. And we'd like to take those and cover them one at a time real quick. We've talked a little bit about why it's expensive, how it's changed. Now let's get into some of the concerns moving forward.
Access to care, they have, oh, wait a minute, I'm sorry. Affordability, they have as number one.
Okay, so let's talk about affordability and the two sides of the spectrum here. We've got those supporting the Affordable Health Care Act and further subsidizing it, claiming that that'll keep rates where they're at or they won't be rising drastically, and saying if we don't subsidize it, the costs are going to double, triple, quadruple for the American citizen. We've talked and touched on why these costs are rising. It's the government's hand in the cookie jar here. The government delegating and regulating all of your healthcare services. Instead of sending money to the healthcare providers, why don't we give it back to the people, is what the Republican side is saying.
Right, and if you deregulated it and got government fingers out of it, I can't say that it would totally leave because there has to be some kind of checks and balances with it. But it would open up the competition again, and competition is healthy for lowering costs.
Right. So if I have my choice, first of all, whether or not to carry health insurance. Secondly, who I want my insurance through, and what type of a plan I'm willing to pay for. As I'm shopping around, these companies are going to want my business. They're going to have to become more competitive with each other. It's a natural thing. The government wouldn't necessarily have to regulate the healthcare industry. They could still, have them make sure they have their insurances and their things they need to have. But healthcare is going to start looking at ways to cut their costs because they're going to want my business. It would also do away with this giving away of healthcare, whether it be to illegals or anybody. I don't know why the government is subsidizing this.
No, and then before the government subsidies, I think about the clinics that were available for people, they're provided by medical institutions. The clinics that were available for people that couldn't afford medical care,
Right, they were
They would
called
go-
free clinics.
Right, so they would go there and get their health care needs taken care of, although they were kind of crowded, but
Yeah, you would have doctors that would volunteer time at these clinics. They would donate their time, doctors, nurses. They would do what they needed to do to take care of these people. It may not be the level of care that you'd get at a level 1 trauma hospital, but you were able to get in there and be checked out and be taken care of. And
any life-threatening thing, hospitals didn't refuse care if somebody come in there with a life-threatening thing.
right.
They didn't refuse care. They worked that out afterwards. But
Yeah, so as far as affordability goes, the government pulling their fingers out of the jar, in my opinion, makes more sense. It will take a step back to the time where insurance companies had to be competitive with each other if they wanted business. And right now, what you've got, just like the state did by pulling all their employees out of this government-controlled insurance, let's take a company like Blue Cross Blue Shield. You get a group of businesses that go in and say, we've got thousands of employees. What kind of a rate will you give us? Well, if I'm looking at thousands or tens of thousands of contracts for health insurance, and I'm competing against the guy across the street, I've got to bring my costs down.
Yep, it's a, let's make a deal time, you know?
Yeah, so the affordability and the question of affordability, uh, I think the government getting their hands out of it is going to make it more affordable. Of course, it's not going to happen overnight.
No.
These medical facilities and doctors don't want to lose money overnight, but they're going to find a way to make their money. But it's going to be through a competitive process. And I think that would be a much better plan, in my opinion.
Right.
I certainly liked healthcare back when I first started working.
Wasn't that great?
Far better.
Wasn't that great? That was wonderful.
Yep. So
That was a highlight of my health insurance life.
there you go.
Anyway,
So now we move on to number two, choice of provider. Well, again, we kind of covered this right in the discussion with availability. If the government's only allowing you to choose from certain companies, you don't have choice. If they open this up and get their hand out of the jar, you're going to have people step up and you're going to have competition between different companies. You're going to have more choice
right.
as to which
It's
provider.
you know, I've had this happen. So under the umbrella of the insurance, I can only go to these providers,
Right.
you know, and I tried out the providers, and I'm like, I don't like these people. I'd like to go someplace else.
Mm-hmm.
Well, if I go someplace else, that opens me up under the current situation, subject to pay the price of the health insurance, not health insurance, but health care rather than the health insurance paying for it.
Right. And,
You know?
and so what you'd have, like I said, right now you've got employers going under group plans to try to get the best pricing. So if I'm employed and my employer is going to pay some of my health insurance, but only if I go with this company that their plan is through. If I choose to opt out of my company's plan, they're not going to give me the money that they would have paid for my health insurance toward that company. And when I go to an outside insurance provider, I have to now pay an individual rate rather than a group rate.
Yeah.
And an individual rate's going to be higher. So
You know,
my
and
choice is very limited.
Right. If you, like in my situation, I felt that the care was subpar. I
Mm-hmm.
felt that they weren't doing everything that they needed to do. And also they sentenced me, they gave me a life sentence to medical prosthetics, which the insurance doesn't pay for, you know. Um, 300 a month, I think is what it was. And I'm like, this is bullshit. So I thought about it and I went to another doctor. I want a recommended professional specialist. And he goes, I do not understand why they're doing this
Right.
to you. To you.
Right. Right. You
So
were a
I'm like,
victim of it.
yeah. Yeah. I'm like, okay. He says, I can do a simple surgery that will correct the problem. I don't know why they haven't offered it to you yet, you know? So I said, well, how do we get that set up? And he said, well, I'll work with the insurance and see what I could do because I'm not under their, you
Right.
know,
It wasn't a preferred provider for that company.
you know, so there was about a 30-day delay to get it done, but he worked it out where I paid the premium to the hospital, and he actually waived his what do you call it, copay on the surgery. Waived his copay on the surgery, and I got that done, and never been happier. You know,
Right.
thank you, Lord, thank you, Jesus.
Right. But you had to go seek that out on your own So it falls right under the category of choice of provider, but there
And I
was
would have,
additional cost.
if there was a fix for what I was going through, I was willing to pay, you know?
Absolutely.
So, anyway, that being said, that's a situation personally that I dealt with the current Obamacare.
Right. And some plans through some employers, again, you didn't have an option for a plan that would have covered the specific thing you needed. You,
Right.
you had to go somewhere else to get that covered. Um, if the government gets their hands out of it and choice becomes something you can do again, it's going to drive the costs down and you'll have a choice to get into the plans you want to get into.
And
Um,
I think it will also make the doctors be more attentive to their profession. You know, I
mhm.
hear a lot of complaints about, well, this guy's not, he don't have very good bedside manner. This guy's this guy's that. But I think a lot of it boils down to what they have to go through to deal with, or to do their work.
Right.
Um,
The hoops they've got to jump through with the government in order to have their license.
yeah. So I don't know if you remember every time the government had their fingers in our business, my attitude didn't stay up, it went down.
Oh, exactly. When the government starts controlling and taking your choices away, that's just not a good thing ever. So, so choices. Our opinion on choices is that the choices will actually open up and create more availability for more choices of health insurance as competition goes and drive the affordability down. So there's the first two. The third one on the list. I'm not even really sure how to address this and how it's a concern, but go ahead and
It's
throw it
put
out
out
there,
there,
Bones.
it's put out there, and I don't want anybody to take this personal because we didn't put this out. This is a list of concerns that's put out by of all companies, MSN. Okay,
Mm-hmm.
uh, they have uh, here listed racial disparities. That's what they
Okay.
call it.
Racial disparities as far as health care insurance goes. Um, I don't even know how this becomes an issue. Uh, it seems that racial or racism has become a buzzword to create division in a lot of subjects.
Um,
I don't
yeah,
understand how this could pertain into healthcare. Racial bias in purchasing healthcare. I don't understand that.
I don't get it either. It's like an equal, or it should be an equal thing across the board, no matter what color you are, or language you speak. It should just be um, presented as such. But anyway, um, I'll just call it an encompassing deal. Everybody involved in insurance,
Mm-hmm.
and everybody involved in purchasing insurance.
Right. Um,
All the people, all the people that purchase insurance.
exactly. I don't understand how you can bring racism into purchasing insurance. Um, although the contention they're talking Affordable Health Care Act and all the free health insurance being given to illegal immigrants. And I think a lot of people, when they hear illegal immigrant, automatically assume Hispanics, when that is not the case. I mean, that may be the majority of our illegal immigrants, where we have the Hispanic countries, right next to us, or but
Yeah, it could be from Zimbabwe. It
yeah,
could be from Sweden.
Canada.
They could be from, yeah, Canada.
They
Anyway,
they could be from any country, but I think that's the perception being thrown out there. As far as I'm concerned, free health care for anyone should not be subsidized by the government. I just don't see it happening. I don't see a reason for it. If I'm not working and if I'm not paying for my health care, I don't have health care. If I don't work and I don't have money to put gas in my gas tank, I don't have gas in my tank. I don't have food on my table. These are all things that I
Okay.
have to work for and
Yeah.
make my
So
money to provide for myself and my family.
right.
I
Yeah, my career, like paying for health insurance is a major thing. Discussions at home, we had many, but we decided it's better that we have the insurance.
mm-hmm,
So the family had to make adjustments to the budget to afford the insurance
mm-hmm,
on a yearly basis because it would go up, you
right,
know, and sometimes it would go up and wages aren't going up, you know.
mm-hmm,
So that's something that we dealt with through the Obamacare period really heavily.
oh, exactly,
Uh, I understand when people, let's say they got four, five, six children, and they want a family plan, and they got to feed their babies. So do I feed my babies or do I buy insurance? They get put in these positions.
mm-hmm. And it was because of
Or
the rising cost and government control.
should I put myself in subject of penalty because I don't have it?
Mm-hmm,
So, human resources, we would, and you know this, but we would explain to them some of the options that they had to get insurance for their company so they didn't or for their family so they didn't have to pay those penalties. And whether or not they did that was pretty much their choice, because
right,
you didn't have to have your company insurance. It was offered,
mm-hmm,
but uh, you have to have insurance by government mandate.
right.
So,
And, and trying to explain that to some folks could be difficult. Uh,
yeah,
Especially when you're,
yeah,
like you said, you're looking at, do I feed my family or do I have health care? Do I suffer the consequence of the penalty at the end of the year when I file my taxes?
right.
And you're digging yourself deeper and deeper into the hole. I know, like you, coming up through the eras before a lot of this started, um, health insurance, like, again, it was provided by my employer at very little cost to me. It was one of the perks of having a job. Uh,
Right.
and from there, how I budgeted and how I fed my family, that was always tight. Uh,
Yeah.
there were times I'd go without eating for 2 or 3 days so that I could feed my children. I was a single father for several years. Um,
Sacrifices that were made, right?
exactly. But it was always one of those, I put myself in this situation by having children, so it's my responsibility to take care of them.
Exactly.
It's not my neighbor's responsibility. It's not my family's responsibility. It's damn sure not the government's responsibility to take care of a situation I created in my life.
Right.
Um, so again, we've talked about this very generally with circumstance, because we don't understand the racial disparity part of this.
Right.
I don't see the difference between me and my Hispanic neighbors, my black neighbors, my Asian neighbors. We're all in the same circumstance. We all have the same choices and options. I don't understand how this is a concern. Maybe I'm naive because I do have friends that say racism definitely exists, that there's undercover racists, all kinds of things like this. I guess
Well,
it's
there is.
hard for me to understand because I don't have a racial bone in my body.
Right. Right. There is racist groups out there across the board. All walks. There's racist groups that are
Oh, I,
black.
I
There's racist.
agree. I agree.
You know,
I see those. I don't see them out campaigning saying don't give health care to any specific
Right, right.
group.
Yeah, yeah.
Uh, so
Stay
okay,
on
so
subject. Stay on subject. Go ahead, tell me.
yeah, so that was kind of a broad covering on racial disparity. It had more to do with socioeconomic disparity. It had to do with personal life choices. Um, and again, not trying to throw this out as a racial issue because I just don't see it that way. Again,
Right.
call me naive. I don't know. I just don't see it that way. I don't see
I
how that card
don't
could be
get
played in this instance.
I don't get why they threw that in there either, but it's there. Um,
Okay, so what's the fourth issue that everybody seems to have a problem with or a concern about, Bones?
it's the impact of policy changes or changes to the policy. They don't, unpredictable is what they're saying, as far as policy changes go.
Okay,
Uh,
now
My my thought, so again, I go back to the competition thing. So I think, we seen over the years with Obamacare the changes in policies on the
hmm
insurance that's provided. Less and less and less and less of the things that you need, and more and more money.
exactly.
But if it's put out in competition, uh, business sort of stuff, capitalism wise,
hmm
right? The insurance companies would standardize their policies.
Well, I think not only would they standardize, I think you'd have more choices and options as to what plans
Exactly.
your
So
family specifically needed.
now they got to create perks to get for people to be attracted to purchase their insurance,
hmm
you know. So my thought is policy changes would be for the better.
And I would agree with that. I think, as you stated, the policy changes we've seen over the past 15 years are watered down policies that you're paying more money for. You've got higher co-pays. It's not paying as big a percentage into the things that people need. Uh, the policies have been watered down. You can't get a policy like I had when I first started on the police department that had a $5 copay and your insurance covered everything else, labs, whatever had to happen during that visit. It also covered your prescriptions, so you didn't even have to
Yeah,
pay for those.
right.
You had
That's all
free
separate
vision
now.
care.
Right.
You didn't pay for anything.
Right.
Uh,
Talking with the medical people, it's like if they want a lab, I need to look to see if the policy will cover lab that they want to provide, or could I afford to pay for it, as it is now.
well, right. There are so many little intricate things written into the policies. So, under my insurance now, um, I pay a copay when I go in. However, once a year, I get a free physical. So I can schedule my appointment as a physical. Now, when I get into the doctor, he's going to go through the points of what is covered under a physical. But if I say during that appointment, hey, could you draw some blood and just check my levels for liver, kidney function, whatever
I
they check,
Yeah.
all of a sudden that becomes not a physical anymore. I'm billed for the copay. Each of those labs that I've now requested comes with a cost, and I'm billed on the back end for those. And it's not the doctor's fault. He has to write it up the way that it's written up, and it goes to the insurance company, and they say, "Oh, we're not paying for this, and
Oh,
this."
yeah, yeah, yeah. Another example for personal, right? So I'm a
Mm-hmm.
I'm a type 2 diabetic along with other things, right? So
Mm-hmm.
pills that they put out, I won't call it allergic, but I have some major side effect reactions to the pills that are put out. I can't take them
Okay.
for type 2. So try to control by diet and exercise, right?
Mm-hmm.
There's another drug out there. He says it would not interfere with, no side effects or whatever, but I have to prove to the insurance that you are in need of this drug. So right now I'm a guinea pig going through the proving stage to try to get the drug that I need, you know, that
Mm-hmm.
would pay. Otherwise I'd be paying like 700 a week for the for the drug, right?
Holy cow.
So because I know this don't make sense, I've got to make you sicker in order to get what we need.
To make you better.
Yeah.
Rather than
So
the
that's
insurance just trusting the doctor when he said, this is the medication my patient needs.
Yeah, the medication's out there. It's there for people like me to get,
Mm-hmm.
but there has to be a proven situation. This is your government fingers inside your medical inside your business.
Right.
So anyway, so I suffer a little bit because I don't have the medication, and I really try hard to control my diet and exercise, but I don't know if anybody like homemade bread is a no-no, but
Mm-hmm.
if there's homemade bread and it's fresh, I'm cutting me off a slice.
Well, absolutely. Quality
And
of life, man.
if I don't have medications to control it, I pay for it,
Right.
you know?
And
So
it's just
anyway,
sad. Like you said, the medication's out there. It's just a plan that you're on says, no, we're not going to pay for that specific one. It's
right,
one of those little intricate things written into those individual policies we're talking about. We'll cover, oh, we're great insurance. We're going to take care of you, except if this is the problem. And
right.
it's written
But
in fine print on
yeah,
page 873.
yeah, yeah. I think that's where it is. I think really do. You've been reading my policy,
Yeah.
but
So impact
anyway,
of policy change. Again, the concern over the years has always been the impact of policy changes, and they've been getting more and more watered down. I'm of the opinion, like Bones, you take this back to competitive insurances, trying to gain people's business, because if you don't have the right product out there that people want, you're not going to have the customer.
right,
I
right.
think the
And
policy
again,
changes will beef the policies back up.
right. I'll say this again. I said it earlier on, but competition is healthy for lowering costs.
Exactly. Exactly. If I'm the only business in town, I can set my price. And you're either going to pay it or not. If I've got 7 competitors, I've got to do something to make myself stand out and be more affordable.
Yeah, and realistically, they're not gonna lose money, and no company's out there to lose money.
Mm-hmm.
Realistically, they're not gonna. So you have to take in consideration of everything involved in your production of whatever it is, uh, and then make a reasonable profit.
Mm-hmm.
But that's where the cost. You learn to streamline your process. You learn to uh, organize and make the better purchases for the whatever it is needed to make what you're making. Um, you just streamline the whole thing and you get rid of waste.
Well, and it's affected all the way down. And gee, the way you're talking, Bones, sounds a whole lot like what the government is doing through Doge. Let's cut the waste, let's streamline, let's get
Oh
rid of
yeah,
the unnecessary things.
imagine
Uh,
imagine that, imagine that. But
yeah.
that's been for publicly owned enterprises, people, private business and stuff. It's been their whole ideal during business is to cut costs, provide a quality product at a reasonable price.
Exactly. Uh, I think getting the government's fingers out of it would get us. We, like we've said before a million times, we're never going to go back to the good old days, but we can
Right.
certainly move in that direction.
Yes, 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 indeed, we can. And I mean, the prices ain't going to go back to what they were. That'll never happen. But
Well,
it can be reduced drastically, I think.
what we know, the prices aren't going to roll back to the 70s, but the wages aren't going to roll back to the 70s either.
No.
Um, I think if you make it to where it's equitable between the two, in order for people to have the quality of life they used to have, that's the goal. And you do
Right.
that through competitive business. You do that from the government getting their fingers out of my cookie jar.
Yeah. Yeah.
Um, so it'll be interesting to keep our eye on what happens with these negotiations over the Affordable Health Care Act, because the Affordable Health Care Act is proven to not be so affordable. It was it's a proven failure. A proven failure to the tune of trillions of dollars being asked of the American public by way of taxes, and the government, specifically Democratic side, wanting to hand out free candy to people who aren't deserving.
You get a vote.
Yep, exactly. So from Padre Havoc and Bones, man, there's our take on this healthcare thing. We're going to keep our eye on it, see where it goes. But from a couple of old guys talking about history, where we've seen it come from, where we've seen it go, and where we hope to see it go, there you have it.
Yes, indeed. Stay positive out there.